Hi everyone, this is a short video to back up the theoretical concept of the water cup analogy that I mentioned during the webinar I presented last week for Function to Fitness. Now the webinar was on managing patellofemoral pain in a runner, and it was titled Deconstructing a Runner's Knee. So let's consider here that the water in this cup is the normal or pre-injury load capacity of a runner's patellofemoral joint. Now as they increase the training loads, the balance between the new load, rest and recovery, and a gradual or progressive increase in load becomes essential. And the tap here represents this balance. I have partly based this on Scott Dye's fantastic work on envelope of function, which highlights the fact that this envelope of function can in fact increase with good training principles of overload, but can also decrease as a result of injury. Now let's see what happens as a consequence of injury, and in this instance, of course, we're talking about patellofemoral pain onset. So this cup tipping over here in fact represents the lack of capacity for the runner's patellofemoral joint to tolerate even the pre-injury levels of load. So when you're seeing a runner in clinic, they'll tell you that initially my knee would start hurting at 4 kilometers, let's say into a 7-kilometer run, and after a period of rest, either because they were advised to rest or avoid running for a period of time, or they just thought that that would be the best thing to do, they go back to running, and they are unable to tolerate more than 2 kilometers worth of a run because the knee pain starts at that point. So that would tie in nicely with this reduced load tolerance. So if you think about a management perspective, it may be actually better to keep them in play and ask them to continue running, only to an extent that does not provoke significant levels of pain. So keeping their pain levels around about 3 or 4 on their pain scale of 10, but also consider other ways like changing running speeds, reducing running volume, maybe even consider using gait retraining measures that we spoke of the other night. Essentially modify load. That's what this phase is about. And then it's a question of building tolerance of these tissues by strengthening muscles, increasing the power in the muscles, etc. And then finally, it's all about trying to increase the capacity of the patellofemoral joint to tolerate an increase in cumulative loads, and that's increasing running volumes. And this is what needs to be done very gradually when you're treating a runner with patellofemoral pain in particular. So there we have it, the water cup analogy. Thanks for watching.